and welcome to another Heart for PCOS interview. Today we have a very, very special guest that I've known for a while now, and I'm so excited to be sharing her expertise with all of you today, Mary Wong. Mary has been in practice for 30 years. She is the founder and director of the North America's premier wellness center, author of Pathways to Pregnancy, certified high performance coach and fertility strategist, a podcaster, an advocate and expert in women's health and PCOS, which is what we're going to be talking about today. So welcome, Mary. Thank you for joining me today.
Thank you so much, Ashley. I'm super excited to be here with you because you're like someone who I totally admire. I love what you're doing. And I love this education that you're providing people with information so they can make their informed choice to take care of themselves.
Absolutely. That's what it's all about. We want to lower the risks for cardiovascular disease in particular, which is why we've been doing Heart for PCOS for the past 10 years. So a lot of times when we are talking about PCOS and treatment options, people are not considering therapies like integrative medicine, acupuncture, and traditional Chinese medicine, which is why I'm so excited to be sitting down with you today. So let's start off with discussing integrative medicine. What is integrative medicine and how does it work?
A physician that I know, he coined it as one medicine, which I love even better, to be honest. Meaning that, you can have different modalities, whether it's Eastern medicine, Western medicine, but integrated together to work as one so that we can serve people and treat the whole human, not just individual parts. And unfortunately, in Western science, well, fortunately and unfortunately, fortunately meaning that we get so deep into very specific parts, so there's like a cardiovascular surgeon, there is immunologist, right? So that they can really hone in on a specific ailment. But with that, there's a downfall because we forget about the whole human. And so when I say integrative, it allows us to use other modalities. So my wheelhouse is in traditional Chinese medicine and acupuncture. So we'll do more of a deep dive with regards to that. But it's like, how can we fill in the gaps of medicines? Because not one medicine is omnipotent. Not one medicine has it all figured out. So let's have a community to help you have your health be where it needs to be.
Yeah, absolutely. So from your perspective, why is using integrative medicine an effective approach in treating PCOS?
It's super, super important to realize that, the Western medicine will come at it from one approach. So for example, if you have high androgens, or, if you're not trying to conceive, you could be put on the birth control pill. Bam, like that. It totally works, right? It totally works, but there might be side effects. And it totally doesn't work if you're also simultaneously trying to conceive. So right. What the heck do we do? And when you go off the pill, it's not like you got rid of the PCOS, it's still there. So we can integrate and also utilize Chinese medicine, herbal medicine, acupuncture, and lifestyle, which is all part of traditional Chinese medicine. Chinese medicine is not just acupuncture and herbal medicine. That's what we're known for, but really it's a lifestyle. And traditionally we talk about Tai Chi, Qigong, meditation, all that is part of the Chinese medicine modality, right? And it's so important for PCOS because we need to look at every facet of one's well-being when it comes to PCOS, whether it's physical, mental, emotional, it's the whole gamut.
I just have to speak from personal experience because I did Tai Chi and it made a miraculous difference in the way that I moved, in my health, in lowering my stress levels. And I think it just made a completely positive impact on helping me reach my goals and my journey, and giving me kind of like that space to exercise my mind and my body was an incredible benefit.
Yes, thank you for actually addressing that piece, because exactly as you said, it's not just the physical body, because Tai Chi, you get taught to move specific ways. So it impacts the physical body, but it totally impacts your emotional well-being, mental, emotional well-being, spiritual well-being.
Yeah, no, it's a very important component. And I don't think we talk enough about emotional well-being when dealing with PCOS. So when a patient comes to see you for the first time, What type of testing might you consider doing? And is the testing different with integrative medicine and like traditional Chinese medicine and acupuncture, or is it the same philosophy as modern Western medicine?
That's again super crucial to distinguish. So in Western medicine, you rely on diagnostic tools. You rely on blood tests, ultrasounds, MRIs, right? All those kinds of things. Now in Chinese medicine, again, dating back thousands of years, there were no diagnostic tools like that, right? So
Exactly.
what did we use? So there are lots of really amazing, incredible ways to look into the body that tells us what is the state of the homeostasis, meaning is the body in balance, is the body healthy, right? So one way, so yes, okay, if you're an acupuncturist like me who is integrative, you know all about the Western piece. So people that come to our clinic at Alive Holistic Health, our practitioners know about Eastern medicine, but they also know about Western medicine. Not all practitioners can say that. So if we're going to jump forward and say, okay, if I want to do acupuncture, who am I going to find? It's like, well, like you need to interview and say, okay, do you know Chinese and Western medicine? Do you treat PCOS? What the heck do you know?
Right.
and then, you know, traditionally add in the traditional. So we would need to know what all the blood work mean when they come back with their diagnosis from the Western medicine, right? Which is great. It's a great to have for us, gives us insight from the more traditional way, which is when you come into the office, we take your pulse, we take your radial artery, and even Western science actually, when we talk about pulse taking, people know what that is because in the Western world, it's utilized, but it's utilized in the way that it is what we call quantitative. You know, the rate and the rhythm. And pulse taking actually comes from China, even in the Western model.
Wow.
So, but beyond that, we want to also look beyond the quantitative and look at the qualitative. How does pulse feel within my fingertips? Is it too wiry? Is it too soft? Is there not enough blood flow going through? Is it too exuberant? Oh my gosh, she's like probably got like a lot of high blood pressure going on. Is there so much stress in the body that it feels like a guitar string? She's like, strung out. And that is palpable. But, you know, obviously it takes effort and time and expertise. So that's one way. Pulse taking, there's tongue diagnosis, looking at the tongue, which is the only visible muscle in the human body. So the color, the coating, the shape, all of that is a reflection of the inner state of the body. And if we think about the healthiest tongue, I would tend to automatically think of like a brand new baby tongue, minus the milk on the tongue. So it would be like a pink, you know, slightly glistening, right? Well, you know, when we're adults, it doesn't quite look like that anymore. So how do we get it back to that? It gives us signs and signals. We palpate the abdomen. We look at the face. We ask a lot of really in-depth questions, like, what's your menstrual cycle like? That's a total missing in Western science, right?
Yeah.
What's the volume of your blood? What, you know, what color is it? What's the thickness? Is there pain? When does it come or not come at all? When did you first start your period? Like all those really nitty gritty things. And not only looking at the menstrual cycle, which we're very focused on in PCOS, but also all the other well-being signs, like your bowel movements, your sleep, your urination, pains, energy levels, all of that.
That is so important because you're number one, looking at things as a full body approach, which I think is vitally important in dealing with PCOS because it is endocrine, which means it affects pretty much every system in our body. So I think it's extremely important. And secondly, you are taking the cues from the body. You are listening to what the body is telling you about this person. And I think that's missed quite a lot. And one of the biggest complaints that patients with PCOS have is that no one is treating the complete picture or looking at these root causes. So what is the actual goal with integrative medicine with treatments for PCOS? Obviously optimizing health, but short term, what are some of the goals?
Well, I mean, short term will be different for each individual. Like we can, we're categorizing PCOS as one thing, but we know as an individual, we are all unique human beings with different health needs and with different health symptoms. So, some PCOS women actually have regular menstrual cycles. So obviously, I don't need to regulate their menses. But a lot of PCOS women don't even have menstrual cycles. And if they do, they're so irregular. It's like, I have no idea when it's going to come, right?
Exactly.
So it is, so in that person's goal, it's let's regulate the menstrual cycle. Let's help regulate the endocrine system. And as you had mentioned earlier, it impacts everything. So what we've seen acupuncture and herbal medicine do is, it will actually help with sugar imbalance. We know that it helps diabetes and diabetes prevention. We know that it helps, as I already mentioned, ovulation. So it increases blood flow to the reproductive organs and the endocrine system. It helps create that relaxation response because we know typically people with PCOS have a higher risk for anxiety and depression and other emotional liabilities is what I say. Right? So it's helping all of that piece. It's just so involved. And so again, depending on each individual's picture, we will focus on that. So that's the other piece about integrative medicine, meaning that you don't strictly have to only deal with Western science, or you don't strictly have to deal with Chinese medicine. You can use the best of both worlds if you wish. You don't have to, because some people say, Mary, I don't ever want to do like Western science stuff. Like I'm sick of the drugs. I've been there. It's not doing anything. Fine. Okay, let's do this. Right. So we can just go through the whole gamut, but the purpose is like, have you be well as soon as possible. And what does that look like? And typically we say, you need to give your body at least 3 cycles. 90 days is when blood regenerates, right? So we can't expect to do 1 or 2 treatments and say, oh, it's not going to work for me.
Right. So one of the things that I want to talk about before we get into talking a little bit more about like traditional Chinese medicine, Tai Chi, and acupuncture is your one specialty is infertility. And that's a really huge, big issue for a lot of patients with PCOS. So a lot of times when we're trying to conceive or going through infertility, it is a lot of taking pills, taking shots, and trying to get the body to regulate through all these different therapies and medications. So how does it look different with what you do and with listening to the body when somebody is trying to conceive and wants to do it more naturally?
So it's really, really different. Number one, we're not only listening to the body, we're also listening to the human being behind that body or within that body. And unfortunately, in the over systemized medical system, and they're overloaded, right? The doctors do the best they can, but at the end of the day, it's really tough to really sit with the patients. While you're lying down for a while doing acupuncture, we're there for you. And we get to know all the ins and outs. And so that's, just when we say dealing with the whole of you, it's not just a physical piece. It's like the emotional well-being impacts the physical well-being. So now I'm going to diverge because I told you I was going to go off tangent. So when it comes to PCOS and heart health, by the way, heart resides in the heart organ, obviously. And we say the associative emotional response that goes with that is about joy and lack of joy. And in our society, don't we just like put on that smile and we are in love with the idea of let's just be happy, stay happy, and let's just have joy and then reject all the other emotions. And when we reject all the other emotions, we just like put it inside us. And that's emotional energy that's repressed. And over time, it can cause physical distress. So in an acute phase, when a lion chases after you, like we have an appropriate response. Our heart beats faster because it's preparing to run. All the blood flow is going out to your limbs so that you can run. It raises your testosterone so you can like maybe fight, right? So, but that's all supposed to be done in that small moment of time. Once you're in the clear, you should be back to normal. But in our modern society, it's like we have lions chasing us 24/7. We don't know how to shut it off. And so what happens is then all that fear and the worry and the anger and the frustration and the grief and the worries and all those emotions that are uncomfortable gets locked inside of us. And with that, over time, it presents in very physiological distresses. So it can impact our endocrine system. It can, which then impacts our menstrual cycle, which then impacts the fertility.
Yeah.
Right?
Yeah.
And when we talk about the fertility piece, but I want to add in, people come in really, unfortunately, for Chinese medicine as a last resort, 9 out of 10. It's like, I've done everything. Now I'm turning to you because I'm desperate.
Right.
And unfortunately, the system of Chinese medicine is actually proactive, preventative. That's how it evolved. So back in the days of the emperor, when they had his physician, his royal physician was Chinese medicine physician, and he was paid only when he was well. So when he was not well, he was not paid. So the whole premise, going back to your original question, it's like, what's the difference? It's like, well, we want to be proactive because, your cause for heart health is about, let's mitigate the risk factors so you don't end up with a heart attack. Well, that's the whole premise of Chinese medicine.
I love it. I love how you connected that. No, that's
right?
perfect. That's perfect. So let's dive into this a little bit because we did talk about the Tai Chi, but what about acupuncture? What exactly is acupuncture for people who may not understand the mechanisms or the modalities attached with that?
Right. Very good. Now, well, back in the day, so I've been doing this like literally 30 years. And the first 10 years is like, acu what? What? But now at least people know, they know the word acupuncture. I'm like, yes, that's progress, man. That's awesome. So to go a little further, it is tiny little, what we call filiform needles that are typically surgical steel, right? They are actually gold needles out there too, for those that can afford. And they're typically disposable, so it's one-time use only. They're sterile, and there's nothing to them. They're so thin, they're as thin as your hair. And so at least in my clinic, about 10 of my needles can fit into the hole of a regular hypodermic needle that will either draw blood or you're injecting something. So it's really, really small and gauge. So if you go to a proficient acupuncturist, you go in and it's pretty anticlimactic. Even if you're needle phobic, you'd be like, is it in? It's like, yeah. Oh, wow. Okay. And then it's like, wow, I feel more relaxed, right? So the point is not to hurt. The point, in fact, when we locate different areas of the body, which has what we call lower skin resistance. So, everyone's now been around COVID, and most of you have gone somewhere where they take your temperature away from your body. They don't even touch your body, right? So we have this electromagnetic field and the source of heat. And that stems throughout the body, and the needles tap in at specific sites where it's most electrically active. Wow. So with very little frequency, you can create a response. So it sends a message to the brain appropriately responds. It's pretty freaking phenomenal.
That is phenomenal. And I mean, it's complex, but not complex. It's such a simple concept, but how it transitions into the body's response is kind of complex. But yeah, it's amazing. And I'm so excited that you're sharing about this. And one of the things I wanted to know is, can acupuncture actually affect the ovaries and the endocrine system as far as starting to repair things and starting to heal things?
Yeah, very, very good. And I'll give a very specific example. So when it comes to PCOS, and one of the common ones is, either lack of menstrual cycle or very, very infrequent, right? And with a scattering of like too frequent, but mostly infrequent and anovulatory. So you don't even ovulate even when you bleed, right? That's very common. So there's lots of clinical trials out there. And by the way, acupuncture is very, very interesting to science now. There's over 15,000 studies on acupuncture to date, right? So people think, oh, there's not much study on it. It's like, no, there's a hell of a lot of studies on it now. Okay. So there's lots you can sift through. And in terms of quality of studies, it's a very hard thing to study because I had mentioned to you earlier, it's an individualized treatment plan. So it's hard to take something that is individualized and try to make it like a global conglomerate type of treatment. And yet still they're finding some really good positive results. So Stenner Victorin in 2000 published a study and talking about electroacupuncture, meaning actually hooking up electrostimulation along the acupuncture needles. And they did, they took a group, like it's a small study, but it's still significant. And what I mean by that significant is that they observed women for about an 8-9 months period. First 3, literally just observation. Then they did a treatment phase for about 3 months to a select group of women. And they found that they saw a big difference of helping to regulate the menstrual cycle, which is really super phenomenal.
That
right?
is.
And it worked better. That said, nothing is foolproof.
Right.
So it worked best for women. Like if we're going to compare women with PCOS, it worked better for the women with PCOS that had slightly lower levels of testosterone. So it's still elevated, but not like crazy. Right.
Right.
And then it also worked better for people who didn't have as much of a metabolic disturbance. So, and that said, again, it's a small study and it was done in a way that was global. But if we treated each person individually, would that outcome look different?
Yeah, no. And yeah, I think that study, because I know of the one study, the Göteborg University in Sweden did that study on the electroacupuncture. And it did show that for some women with PCOS, it helped them to ovulate. So
yes.
That was amazing. And one of the things that I wanted to know is what actually is the difference between traditional acupuncture and electroacupuncture, and what are the benefits of one over another, or are there benefits, or should they both be used together?
I think it depends on the kind of clinic you're at. Some people don't use it at all. Some people, that's all they use. And, we have to again, I would bring it back to the individual. If you're a person who's scared, what I call needle shy, you might not want that. Right off the get-go. Like we do I do what is, again, and more of an integrative, interactive acupuncture at our clinic. So it's not like I do what I want to do to you. It's like I got to do with what works for you. Because if I raise your adrenal stress with acupuncture, that to me is pointless. We want to induce a therapeutic effect. So if I'm fighting with you, that's not so helpful. So for that person who's quite shy, then I would definitely use more of a more relaxed approach with less stimulation. And with less stimulation may not necessarily be electrostimulation. Now, with that, the electrostimulation that they used are really low frequency. So I'm going to get a little scientific. I love science, by the way. So, so I'm in Chinese medicine, but my background was actually in science, and I was going to go into med school, but then my grandmother got sick. And it was Chinese medicine that saved her within 3 months, and she lived another 8 years. They told her she was going to die, and she was going to die in 2 weeks. Anyway, she lived another 8 years. So my point is, my science background, I still have a love for it, but I also love this art and science called Chinese medicine because it's like freaking miracle. So anyway, back to your question about traditional acupuncture. Does that work? Yes. Frequency style acupuncture, yes, but I would say low level frequency.
Okay.
So 2 hertz. So if you go to an acupuncturist for pain, sometimes they use a higher stimulation. Like Dr. Ho's that you use at home, that's totally not the kind of style we use at all when it comes to therapy. Dr. Ho's, the high frequency stuff, it cuts pain. It doesn't help healing.
Yeah.
We want to help healing. So it's low frequency. It should be like a pain-free process. In fact, most of the people that come to our clinic, they completely relax and fall asleep.
I love that. I love that, because That is so important, that we feel comfortable, we feel relaxed, and we allow our bodies to heal. I don't think we spend enough time letting ourselves just relax a little bit and trusting in the process, I guess you could say.
100%. And, like people come in the door when they're trying to conceive. But listen, I have people that are with me now, and it's been over 20 years. They're certainly not trying to conceive for 20 years. I'll tell you that. It's the, postmenopausal and, dealing with all the aches and pains. And then again, preventing cardiovascular risks.
So another component of this that I wanted to talk about with traditional Chinese medicine in particular are herbs. And what role can they play in helping restore hormone balance, and what role do they play in traditional Chinese medicine?
So PCOS is under the realm of gynecology when I look at TCM textbooks. But within that, we look at it as more of like the miscellaneous things. But, when it comes to menstrual cycle and overall health, herbal medicine is a giant piece, right? So in the clinics in China, you'll go to the hospital and they'll have like wards where they actually cook Chinese herbs for the patients, whether it's Western medicine or like it's all amalgamated. So they'll have a TCM section for Chinese herbal medicine. They'll have the acupuncture section, and they have the Western science section. So it comes together. And in Chinese medicine, we say 1 + 1 is 4 in exponential effect. Right?
Yeah.
So, and it's not about, there's no confusion because they work together. They work synergistically. We diagnose the exact same way using the pulse and tongue and asking questions and palpating and looking at the face. And in fact, even the voice says a lot about a person.
Right. So along with doing things like the acupuncture, the Tai Chi, the herbal medicine, how important is it to add in lifestyle changes such as nutrition, exercise, and sleep in a PCOS care plan?
Well, that's the first rung, actually. So in Chinese medicine, the acupuncture, the herbal medicine, is actually the lower rung, because what I told you from the beginning is that it's about prevention.
Yeah.
Right? So you have to prevent through your lifestyle habits. And then you add, and the Tai Chi, the Qigong, the eating well. And in Chinese medicine, we love eating like warm foods. Stay away from cold, icy things and sugary things. And a lot of it overlaps with the Western nutrition actually too, right? Like a lot of PCOS will say, dairy products may not necessarily be the best idea. In Chinese medicine, we say it creates dampness in the body. And if you think about dampness, it can, like, if we're like, not if, we are about 70% water. And it should really flow like an ocean inside of ourselves. And unfortunately, a lot of women with PCOS, there are what we call conglomerations and congealations, meaning there's cysts, there's fibroids, there's literal phlegm, there's like phlegm nodules on the skin, right? And so that tells us that it's not behaving like water anymore, and we need to get things behaving like water. So things like dairy does not help it. And even Western science knows this now.
Yeah. Yeah. So it's creating this flow and making sure that the flow, oh, I love that. Just the whole philosophy about just, again, listening to the body and responding to what the body is telling you is just an amazing philosophy, and I think can go such a long way in PCOS care. So since we are here as part of the 10th anniversary for Heart for PCOS and talking about PCOS and reducing risk for cardiovascular disease and prevention and optimizing health, can you talk about how these therapies we discussed can help reduce risk for things like insulin resistance, high cholesterol, high blood pressure, and ovulation?
Yeah, I mean, all of it it's not just important, it's essential, it's critical. I mean, we need to know about this because we need to have ways and be educated so that we can take charge of our own selves, so that we can be proactive in our care to prevent heart attacks, so that we prevent the increased risk of hypertension and high cholesterol and depression and anxiety and insulin resistance and diabetes, all of that, which puts us at risk with heart disease, right? We need, like, it's no question. I mean, this is a crucial piece, and that's why I'm such a big advocate for you, right? So, because again, this is part of my mandate. It's not just about, like, why the heck do we treat cars better, right?
Good question.
You know, it's like we're so busy being moms and working and all that stuff, and like we put ourselves last.
Yeah,
Like,
no,
stop
we
being a
have to
freaking
change that.
martyr, and we have to change, and we have to take care of ourselves. And it's not selfish, it's essential, it's critical, because that will make you a better person. That will make
Absolutely.
you, like, in health and in how you be with your family. Like, you know, if you're feeling crappy, you're not going to be your best self forward. And so you may not be as nice to your family as you would want to be. I'll speak for myself. No naming, like no pointing fingers. I'll just speak honestly for myself, right? So it's
Yeah.
essential. I have to take care of me. And you know, one of the purpose of that is, and I think you're the same way. It's like, we're here so that we can guide you and help you so that you can be your best selves, to make a difference in your life. And more importantly to me, it's like, so you can make that difference for the next generation and the next generation after that. And when it comes to epigenetics, which is the environment that you develop in, so with the community of people around you and the what you do for yourself, really impacts your physical well-being, your emotional well-being. So it's critical, right? So do things like acupuncture, but also do things for you, and, like, you know, do things that will make you smile and, like, real joy versus like pretending to be happy.
I think that is a key point. And like you said, I think we're so consumed by what surrounds us in life every day that we tune out what we need as individuals, as humans, and what we deserve. And that's a message that I think should really resonate with people, that it's time to change that narrative, and it's time to take back our power for ourselves, for our health, and for our futures.
Just going back to how important this conversation is, right? One of the most common things that women say to me when they come in is like, okay, Mary, I've done X, Y, and Z. I've done everything. What else can I do? And I'm like, so if you're not doing it all, then yes, of course, go and actually work on some of those pieces, because we know what to do. So it's like, how can we get you to do some of those things? But if you're the person that says, you know what, I've done everything, but yet, you know, what else can I do? Because I feel like I'm missing something. I always go back to the land of, it's actually how you're being as you're doing. So how are you being? And focus on that. It's not about doing more. It's what, while you're doing whatever you're doing, how are you being? Are you begrudging, or are you doing it authentically with your heart and feeling good about it? And reassess.
I think that's really important, Mary, because I think with PCOS, we for so long have been told we're not worthy, that it's all in our head, uh, that, you know, we're too emotional about things. And I think over time you emotionally harden, um, because you begin to believe that you're not worth the care, that you're not worth investing in yourself. So it's an extremely important message to hit home with patients, that you do matter, your voice matters, and there are people who are going to listen to you and who are going to help you regain that strength, empower you to do the things that you need to do to get healthy.
Yes, and that's in community with people like you. And that's why we created Myfertology, and Myfertology is a made-up word, and it's basically the biology of a person going through their fertile life and creating that fertile seed of you. You are the fertile you, by the way. It's not about the baby. It's about, let's create the fertile you,
I
right?
love that.
How do you mother yourself? And through all the transitions of life. So, you know, preconception to pregnancy, to postpartum, to perimenopause, to menopause, and beyond. that's and we go through your stages of life, both mentally, physically, emotionally, and coming at it from our experience. So Dr. Tanya, who you interviewed as well, Dr. Tanya Wild, she's a naturopathic doctor, and myself as a doctor of Chinese medicine. And then we interview people like you and other physicians to really give you like a real grasp of knowledge to take back your health. And so the other piece to the podcast is I also wrote a book called Pathways to Pregnancy. So I need to give a shout out to that. And I want to mention that when I was interviewed by Amy Medling, the PCOS diva, who some of you guys know, when she interviewed me this year, she said, Mary, I don't know why I didn't know about your book, because literally it's the best book she had ever read. And she's
Amazing.
like, look at this behind me. I have a giant shelf, and this, like, everybody needs to read this book. Right.
Yeah.
So
No.
I'm not going to be shy about it anymore, because I'm like, oh, I don't want to like gloat or whatever. But seriously,
Gloat, girl, gloat.
Okay?
It's a great book.
So, I want to help all the women transition through life through different ways. And those are two pretty well free ways of getting at it. But if you want to get in touch with me directly, you can do so. You can email me at you can go through aliveholistic.health.ca and email me through that, but you can also DM me on my social media, like on Instagram or Facebook, all of it. It's Meet Mary Wong. Okay. And obviously you can come to our clinic, which is like literally the premier clinic of North America, if I may say so myself. But if you're in Toronto, you can come in directly. But if you can't, and if you're remote and you need some coaching around you for whether it is your PCOS, your life, or your business, like however, then I can help navigate that through coaching as well. So just reach out.
I love that. And I will make sure to share all of the information and the links so all of you can follow up and follow Mary, because I promise you will not be sorry if you do. So Mary, you have just opened the floodgates as to rethinking PCOS and PCOS care today. And I thank you so much for giving everyone a little more insight into integrative medicine, into traditional Chinese medicine, into acupuncture. I think it's important to know that we don't have to stick within one little box, that there are a lot of different alternatives and options out there. And I hope that you will help all of us learn more in the future and come back and chat with me more about what you do and how you do it, and the love that you do it with. And just thank you for being light and love and happiness and joining me today. Thank you.
Thank you.
So everyone, thank you so much for joining the Heart for PCOS campaign, which is running throughout the month of February. Please be sure to follow, to like, to listen, and to share great interviews like the one we had today with Mary. And we'll be seeing you again with more content, more events, and more ways to get involved with Heart for PCOS, the PCOS community. Have a great day.